What's up everyone? So I feel like I haven't done a video in a really long time, but I just got back from a traditional Korean wedding and I'm sitting here in my apartment and I figured why not do a video. This video is going to be about Lasik surgery in Korea. Some of you may not know, but I used to wear contacts and glasses. I've been wearing glasses I think since grade 11, high school. So it's been a few years now, and contacts too along the way. So when I moved to Korea, LASIK surgery was something that I really wanted to do and that I was thinking about, and I finally did it. 3 of my friends and I went up to Seoul, and we actually went to the Seoul Eye Group Glory Clinic in Gangnam, Seoul, and what we did is we actually got the consultation and the surgery in the same day. Since we're from the Jeolla province, they told us that if we came up we could do the 2 in the same day, and so we just decided to go ahead and do it. Like I said, we went to the Seoul Eye Group Glory Clinic in Gangnam, Seoul, and pretty much everybody there spoke English and were really friendly, really nice, and just took care of us. It was a really great place to go. I highly recommend it if you're looking into doing the LASIK or LASEK surgery. LASIK? So when we got there, we had our appointment was booked for 11 a.m. So we got there, we pretty much just did our consultations. They did like a million tests, which obviously they would have to do to make sure that you're a candidate and to be able to determine which surgery you're actually a candidate for. So either you're a candidate for LASIK, IK, or LASEK, EK. All 4 of us actually ended up being candidates for LASIK, IK, so that's what we got, which is the least painful out of the 2 also. For the procedure itself, they bring you to a different floor, and it's obviously where the surgery takes place, and they have a little waiting area, so all 4 of us just sat down and then we went in one by one. And the surgery itself is very quick. It literally takes 10 minutes or maybe just under that. And basically when I went in, the lady, she put me on a table, so the nurse, she just made me lay down on the table. They put this gel in your eye that's supposed to numb it, I guess, so you don't feel anything while the surgery is going on. And basically you wait there not that long, like a minute or 2, for the surgeon to come, and he comes, and the procedure actually uses 2 machines. The first one is actually used to create the flap in your eye, and the second machine is the laser that they use to correct your vision. It's honestly, I'm not gonna lie, it's really scary. And you sit there on the table and you're looking up. They tell you look up at the green light, and you're supposed to stare at it and not move your eyes, which they put like a suction cup in your eye to cut the flap out, and also so that your eye doesn't move around. So don't worry about like it rolling back or like blinking, because they have that suction cup and whatever to hold your eye in place. And literally you stare at the green light and they just cut your flap, and then at the second machine they laser it, which you're still staring at another green light, and they laser your eye, and voila, it's done. That's the surgery. While the procedure is going on, you're probably gonna freak out a little bit. It's normal. I actually was holding my breath for a lot of the procedure, but the doctor, the surgeon, is really nice. He talks to you during the surgery and he tells you what he's doing step by step. Everything he does, he's like, okay, I'm going to remove your flap now. I'm going to put this in your eye. Please don't move. Look at the green light. Don't move. And there's nurses there, and you know, they like pat you and they're telling you you're doing a great job. So I mean, they try to put you at ease as much as they can, but yeah, it's pretty nerve-wracking. And like I said, it takes 10 minutes. Once you're done, you're off the table and you go into this little booth next to the waiting section, and they check your eyes to make sure that the procedure went well and that there's nothing wrong. And I, of course, had a foreign body in my eye, so I had to go back on the table. Literally for like 2 minutes, they reopened my flap, cleaned my eye out, and then closed my flap back up, and I was out. Checked my eyes again, and I was fine. So they asked me to take a picture with the surgeon, took a picture, and then we waited for my last friend to go in. And then once we were done, they sent us off to a hotel. So the clinic, actually, this is inclusive in the price that you pay for your surgery. They book you a hotel and you stay there for the night. And then the very next day you go back to the clinic and they do a checkup and then you go home. Right after the surgery, when you get out, your vision is, they say blurry, but I feel like it was more cloudy. Like there was just like kind of like a very, very thin like sheet of white paper, but like a see-through white paper. And like you could see everything right away, like no contacts, no glasses, you're seeing things, but it's just very cloudy, I guess. And I don't know, basically what we did is we went to the hotel, we slept for like 17 hours straight, woke up the next morning and there was no cloudiness to like my vision. I could see everything. It was really weird, but really great at the same time. So out of the 4 of us, 2 felt pain and 2 didn't. I was one of the ones that didn't feel any pain. But what I did notice was that when I went to sleep, I would close my eyes, but they would just open by themselves. Like I wasn't able to shut them, and I thought that was really weird. And I think it obviously had to do something with the surgery. They just wouldn't stay shut. That went on for about like 2 hours, and then after that they just closed, and that was that. Didn't feel any sort of pain for the rest of the time. Next day we went back to the clinic for a checkup, and they check your eyes, make sure that everything's right, that you don't have like an infection, I guess, or any other foreign bodies in your eyes. So we went for a checkup and we went back to our respective towns in Jola. After 1 week, you're supposed to go for another checkup, but since Seoul is kind of far for us, they wrote us a letter basically stating that we could go to any eye clinic and get a checkup there and that there shouldn't be any problem. And then they did ask us to come back for our 1 month checkup, to come back to the actual clinic. So we'll be going back to Seoul in about 2 weeks to get our eyes checked and make sure that everything's okay. At my 1 week checkup, they did tell me that my left eye was healing a lot slower than my right eye. They told me that it's normal and it happens to people, so I shouldn't be concerned about it. Well, obviously, I mean, I don't know who's not going to be concerned about it, so I'm a little concerned, but I'm gonna wait and see what they say in 2 weeks. I don't feel anything is wrong with my eye. I can see out of it perfectly. Like, I don't have any problems. I don't know what they were talking about, but hopefully I get some good news when I go there. Oh, one more thing. After the surgery, you're actually supposed to put like artificial tears and whatnot in your eyes to like keep them moisturized and to keep them from getting infected. So they give you 3 different bottles. The first one is this one right here. And this one is actually steroid drops. I'm not really sure what they're supposed to be doing, but you put these in your eyes 4 times a day. In the morning when you wake up, and then a little bit like close to like noon or early afternoon, then later on in like the afternoon, and then right before you go to sleep. And that's 4 times a day. You're supposed to put them in your eyes for about 2 months post-surgery. They also give you this bottle right here, which are artificial drops, so teardrops. This one is just, it's literally just liquid, and you put them in your eyes, and it's just supposed to moisten your eyes. So right after the surgery, you're supposed to put these in your eyes every 10 minutes, and then the next day you put them in your eyes every 30 minutes. And then they also give you this bottle right here. So this one is an antibiotic so that your eyes don't get any sort of infection. This one you put in your eyes for a week. So I can't remember actually how many times you're supposed to put this one in. I think it was 4 times a day as well, like the steroids. So 4 times a day for 1 week, and then when you go for your 1 week checkup, they pretty much tell you to just not use it anymore. So there's the checkup the following day after your surgery, then there's a 1 week checkup, then there's a 1 month checkup, and then there is, I believe, a 2 month checkup and a 6 month checkup. As far as the surgery goes, it was really scary in the moment, not gonna lie. Because obviously they're your eyes and anything can go wrong at any time. But I mean, these guys perform these surgeries like hundreds of times a day, and throughout the year like thousands of times. So, you know, obviously professionals and some of the best in the world. So I highly recommend the surgery. It's one of the best decisions that I think I've made. I really just love being able to wake up in the morning and see without wondering, oh, where are my glasses? I can't see. And I love being able to go to sleep at night without thinking, oh, I should take off my contacts, or traveling and not having to bring like contact solution and your contact case and thinking about taking him in or taking him out and putting him in every day and at night. It's just really so much better like this. So I highly recommend it to anyone who's thinking about getting the surgery. Don't psych yourself out by going on the internet and reading all of this stuff about like horror stories, because I think they're rare. Like, not everybody obviously goes through these experiences. There are some horrible ones, but I wouldn't read them if I were you, because I started reading some and I really psyched myself out. And then when the actual surgery happened, I was just like, oh, not that bad. So don't psych yourself out. Just go for it if it's something that you really want. This is it. If you have any questions, just comment in the comment section below or inbox me and I will try and answer you. Bye guys.